Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal Sentinel.
WisconsinEye is at Marshfield Clinic interviewing Republican Representative Pat Snyder of Schofield, seeking re-election in the 85th District. Pat, welcome back to WisconsinEye.
Well, it's good to be back. Thank you.
You were co-chair of the task force on foster care. Now, you passed a number of bills. What's left to get done on foster care as it becomes an increasing issue given the tragic methamphetamine, heroin, opioid epidemic?
I still think we need to concentrate on prevention. You know, one of my bills that came through was the TANF money, $1 million worth into the prevention measures. Some nonprofits or organizations that will see at-risk families before they get into the system. I think that's very important. And I think the next thing I need to work on with my fellow legislators is we didn't get things complete with our aging out. These kids that are 16, 17, 18, we really need to focus on them, because some of the statistics that come out show that 1 out of 2 end up being incarcerated because, you know, of the trauma they've had through foster care. We found out that 80% want to go on to college, but only 2 to 8% actually go to college. And the federal government has money for them for tuition fees, but there was some left over. We tried to get that through. It got through the Assembly to finish, you know, with that, but it didn't quite make it through the Senate. So that might be something more to address. So the main thing is we don't let these young men and women, when they age out at 18, suddenly fall off a cliff. We have to be aware that they have careers ahead of them, and they have to, you know, join the rest of us here and be productive for themselves and for the state.
As co-chair of that task force, what did you learn about the next steps to fight our tragic epidemic of methamphetamine, heroin, and opioid abuse?
Boy, that does seem like, I know that the Attorney General and Representative John Nygren with the HOPE agenda has done a lot. I was able to ask for in the Joint Finance to get additional money into the deterrent for a drug court. We do have a drug court now in Marathon County. I do think that treatment is an area that needs to be addressed more. And it's just, right now, Marathon County is right in the center. The sheriff told me that south of 29, it's opiates and heroin, and north of 29, it's meth. And it's just, it really does not only disrupt these individuals and their lives, fills up our jails, but then again, back to the foster care, it removes kids from their biological parents. And that's a lot of trauma to put on a young boy or girl.
Let's talk about healthcare a little bit. Healthcare in rural areas. Rural areas, household income is not as high as a statewide average. Young people are leaving. More and more healthcare is being provided either through Medicare, Medicaid. How do we continue, maybe improve healthcare in rural areas? Well,
one thing I will bring up to the speaker, and we're lucky, the Lisa, who is the Dean of the Medical College of Wisconsin in Wausau, came from Oregon, and her specialty was rural health. And so I'm going to urge the speaker to maybe put together a rural health task force like we did with foster care and address these issues, because you mentioned it. We're aging as a state, but especially in the north. And a lot of the physicians that come in to our state either leave the state or maybe migrate more toward the south, Milwaukee, Madison, areas like that. We have a great college there in Wausau with family practice residency, a psychiatry residency, and I think the more we can do to take our nurse practitioners, maybe have them work with a doctor to be able to go mobile into some of these rural areas, into some of the assisted living homes, because to be healthy and to stay healthy is very important. I also would like to see, it kind of died out in committee, but I had a bill for palliative care. And this was something that was going to put a committee together to look at palliative care and make recommendations to the Department of Health Services on how to let folks know that palliative care is out there to take them home. So many people have the misnomer to think palliative care is hospice, but it's not. It's more than that. New York State has implemented their palliative care, and they're saving hundreds of thousands of dollars because people go home or they're not staying in the hospital longer. Medical directives are so important. Meeting with the head attorney for Aspirus, he says he does 75 cases where he has to go to court to get guardianship of a wife who's been married, 45 years to her husband. If he can't speak and they have to move him to assisted living or rehabilitation, she can't say this is what he wants to do because the medical directive. So that's another area we need to look at as well.
So does state government need to do more to retain and recruit doctors, nurses, and other medical professionals?
Absolutely. The great stats are that if a individual here in Wisconsin goes to medical school in Wisconsin, gets a residency in Wisconsin, there's about an 86% chance they'll stay right here in the state of Wisconsin. And even some stats show that if you're a resident or you do your residency in whatever state that is, a lot of times 3 years, you kind of put roots down and you end up staying in that state. So the more we can attract residency here and in all fields, family practice, internal medicine, psychiatry especially, that will really bode well for building up our health professionals.
You sat through a lot of caucuses on highway funding issues, that impasse in the Capitol. How would you break that impasse in terms of paying for our highways?
Well, we had a pretty good idea with the Assembly. I know I met with the governor in June of 2017 in our 1-in-1, and I told him that my constituents, when I was going door to door, had no problem. They didn't see a rise in the gas tax as actually a tax. They look at it more as a user fee. And to tell you the truth, I told the governor I was for a nickel increase in our gasoline sales tax. Some want maybe a dime. But I tell you, I'd also like to bring back for debate gas indexing. Now that we have that constitutional amendment that says everything in our transportation stays in transportation, I would like to see that. I think the general public that uses the roads realize that if you're retired and maybe don't use the road as much, you're not going to be taxed as much because you're not using as much gasoline. But in the same sense, if you're using the road more, you want the roads well because it doesn't shake it up. Marathon County alone, the highway commissioner said we have 47 bridges that are in need of repair. So it's an issue that I hope the governor and the Senate is a little more receptive of, and that we can come with some kind of a compromise with that. I know the governor told me that in the time he's been in office, compared to the years that predecessor was in office, he's actually put $3 billion more into transportation. But, costs have gone up and things to that nature, and we still are trying to recover from the time when it was removed from the budget back before the amendment was there to, try to catch up. And not only that, but we did pay down the bond a little bit, but I don't like borrowing either. So I hope we can increase the gasoline tax. Right now it's about 32 cents. If we would have kept indexing going, it'd be about 39 cents right now. So I think people would be okay with 39 cents tax, knowing that that extra money, a nickel, would be $133 million. That can go a long way with our counties and with our state roads.
The buzz in the Capitol on tolling, any interest in it?
There is a little bit. They talked about it a little bit. They kind of earmarked like 94 being a tolling. We'll have to address it again. I know some of the concerns some of the people in my district brought up was, well, how much will it cost to implement? If they can do it technology-wise pretty well. I did find out a lot of people have those passes for their cars because they go down to Illinois. I had a gentleman that actually fishes walleye in Lake Erie, and he uses it and goes all the way out, there and doesn't have a problem with it. And just so the roads are well maintained. And I did realize too that when you do toll, the money for that toll road can only be used on the toll road. And also maybe the side roads, frontages that are next to that toll road. But if that's the case, then that would be extra money for the rest of the state to use on our other roads if they do pass it. But I'll kind of, if it comes up again, I'll listen to what my constituents say, what they feel on that, how many actually travel 94, because that sounds like 94 is the one likelihood when I heard mentioned the most.
Some local officials say levy limits are really hurting their ability to provide local services. Keep them in place, dial them back, or get rid of them?
The one thing I hear, and I know the local officials, I feel for them because they need the extra revenue to be able to accomplish the things they want to accomplish. But I tell you what, the one thing that seems to really get under the burr under the saddle of my constituents is when December comes and those property tax bills come. And we have worked really hard to kind of keep those low and manageable. And even still, some of my Wausau residents are still upset at some of the property taxes. I had a gentleman just move in from California into the Wausau Northeast side, and he said his taxes are $5,000 more than he paid out in California. So I think, I know we got to figure out maybe some other ways where we can help the local municipalities and cities be able to try to increase some of their revenue. But in the same sense, when I look out for my taxpayers, it's good to keep that in place.
School shootings, mass shootings, do we need to change gun laws?
As far as, the thing is that I think federally they might look into something on the mental health issue. I would like to explore that opportunity where if a juvenile, let's say that it's in school and has been suspended for assault or is seeking counsel, that maybe there could be a red flag. Doesn't mean you have to avoid HIPAA laws or anything to that nature, but maybe have a red flag so when the time they're 18, it just comes up the medical red flag and they need to get cleared by a medical professional for that. My superintendent for DC Everest, Christine Gilmore, had a really good idea. And of course, we have the extra money now for school security. But the school resource officers right now, they come out of the police force and they get trained in the academy and they do a great job for that. But she thought maybe coming to the technical colleges and actually having a course taught for school resource officers where they learn on everything that has to do with intervention with violence and how to get that comfort level with the students and how to react in situations. I think that's a good idea so that every elementary school could have a school resource officer there that could be friends with the students, but also show a line that they're there, and maybe some other type of technical ideas that could come up, like, I'm just throwing things out, like if a school shooting starts in one part of the building, to be able to have the opportunity maybe to close off that area, have like partitions that will close and lock and keep that person out of the rest of the school. Actually love to hear the different ideas. There's some great people that have even written books about school safety. So, it's just something that in our environment today, we're going to be facing this, I think, down the road.
You voted for a budget that had a big increase in state aid to our K-12 schools.
Absolutely.
Do we need another similar big increase in the next budget?
We need to increase it for the resources. Yes, I would be for that. $200 first year, $204 the next. And when I talk with my superintendents, I'll get a good idea of what they think. But to get these kids through the K through 12 process, and what I really like now too is, and DC Everest was already doing it, but to get to these middle school kids and start a career path. Just get the idea of what type of career do you want. There's a lot of great careers in carpentry and plumbing that have trade schools, technical schools. Not everyone maybe wants to go on to a 4-year college education, but there are great careers that pay well in other areas. And if we introduce that, I think that's great. I think the Fab Labs are something that's really going to take off statewide. And the technology and the innovation and really seeing some of the entrepreneurship coming out of these middle school and high school kids, I want to nurture that and actually fame the fans, stroke them so they just burn hot.
Choice and voucher program has been expanded. Has it expanded enough, or do you want it to expand even more?
I think it's good to where it is right now, and I know that there's some. My daughter's a public school teacher, and she's brought up some concerns. And I did say, what they might lose through the voucher, they can go to the levy, the school board can, and make up for the lost revenue. But I do still stick by that. I think the parents have a choice of what school that they would like their child to attend, and Senator Ron Johnson's come forward and said he'd love to see every parent just have whatever the voucher might be, and then they can pick the school they want to go to. I don't know if we ever get to that point, but I do believe the parents should have a choice. But in the meantime, I do not want to take away from the public schools, because they do a fantastic job in so many different ways, not only with educating our kids, but also some of the disadvantaged kids as well as special needs kids. They do a marvelous job, at least in my 2 districts that I represent.
The prison in Waupun and Green Bay were built in the 18th century. We're closing the 2 juvenile prisons. Do we need a new state prison?
Yeah, that's coming up as well, and I would like to look at, you know, the folks that are incarcerated, and really, I know Representative Goyke is very much looking into this. I would love to be able to work with him to see if there's a way we can somehow restructure as far as who's in prison and maybe the stay in prison and things of that nature. I've had some supervisors, I don't know if it'll happen or not, but they've come to me with an idea up in Irma, which is one of the juvenile facilities that will be closed, and then something else will be put there. Maybe thinking of it as a incarceration for those with drugs, and maybe have a treatment center there as well as incarceration. That, you know, innovative things like that need to be discussed, but if we go through and, you know, look at the situation what we have, a new prison might be needed, but in the same sense then close down one of these aged ones.
How do you answer 85th District residents who say $4 billion in state and local incentives for Foxconn was a bad deal?
I talked to them a little bit about that. First and foremost, it's a $10 billion investment. It is something that the money won't be you know, we just don't hand them $4 billion and say thank you for everything. They have to put in the 13,000 jobs, $53,000. But when I saw the Milwaukee Chamber of Commerce report saying that every dollar we invest as a state, we get $18 back, that's a pretty good investment. I'd do that with my 401k if I knew that was coming. Also, some of the areas in my district, like Merrill Iron and Steel, are subcontracting in the first building. So they're seeing some of the effects. Plus, I was fortunate enough to have dinner with and tour our ginseng fields with Mr. Gao. He came up, and the Innovative Center in Green Bay shows the spread out. Milwaukee, putting in the corporate headquarters there. And in talking with Mr. Gao, he is very much into the medical research. So I see things expanding in Madison with the UW system. And also I see things opening up for Wausau, Eau Claire, and other parts of the state. He told me he really thinks that Wisconsin now is part of his family, and I think we're going to see huge benefits. You know, when I was on the Committee for Jobs and the Economy that heard the testimony, the person that really convinced me of this was the president of Marquette University, Mr. Level. And he said to me that he was at Pittsburgh as a dean when Google came in. And of course, Western Pennsylvania was ravaged by steel and the closing, and it was really depressed. He said they came in, and what really amazed him was the clustering effect that came in after them. And he said it just grew the economy in Pittsburgh and Western Pennsylvania, and it spread across Eastern Pennsylvania, and he was adamant that it will do the same in Wisconsin. And I thought someone who had experienced it, he convinced me that we can see the same results. So,
time to legalize medical marijuana or recreational marijuana?
Recreational, not at this time. Medical marijuana, I'm leaning both ways. You know, I'm still ambivalent on that because I am very much involved with my Marathon County Drug Task Force folks, the police. But, you know, I had a gentleman who just called me with stage 3 cancer. And, you know, he was wondering, what I would love to see is the federal government maybe declassify it from a Schedule 1 so that our University of Wisconsin can then get the research started on medical marijuana and actually create things. And if it gets to the point, I don't want to follow a California model where you see these medical marijuana health stores where you bring in a card and anyone can get it. I would like to see it somehow come to the doctor's office prescription to a pharmacy so we can at least have some control of that. But I would be very willing to listen to that because I hate to see people in pain. And you know, the efforts we made on the opiate front, I'm actually having constituents call me saying that the emphasis we're taking on opiates now, doctors are taking them off things that they were fine on and their pain's going up. So we're I'm hearing from a few that are seeing the other side of our combating the opioids and the other drugs. and saying that, you know, the doctors are re-examining that with them. And I had a priest, believe it or not, that had a bad leg pain, and his doctor took him off Oxy, which he was having no problems with, no addiction problems with, but he thought he could manage without it. And he says he's in real pain and was wondering about if he should start smoking marijuana. And I just said, well, let's work on it.
Last question.
Sure.
You want to highlight any differences between you and your opponent in the general election?
Well, I think that the one thing that that bring forward is, you know, I ask people when I go out, I say, what percentage of the bills that the governor has signed do you think are bipartisan? And I'll get 10%, 20%, sometimes even 30%. And I said 91% of the bills are bipartisan, the governor signs. And I said the key to getting things done is bipartisanship. And that was evident in our foster care task force. That was evident in getting Sarah's law through for our attorneys at other states, and now are looking to what we did and maybe copy that. That was also instrumental in the right to try before it was approved federally as well. I was so proud to have 5 of my bills signed by the governor in my very first session. So in working with the people, getting a start on the foster care, getting a start on what we need to do to combat drugs, keeping the taxes down for folks, and the other things we need to keep working on, roads, making sure our schools are funded fully. That's what I continue to plan to do, and I have the experience now to be able to continue that.
Thank you. Republican Representative Pat Snyder of Schofield is seeking re-election in the 85th District. Pat, thanks for talking to WisconsinEye.
Thank you for the invitation. It's great.
Thanks.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal Sentinel.